A healthy 27-year-old just had a heart attack and her birth control pill might have played a role. She'd been taking the combined estrogen-progesterone pill for 7 years to manage her PCOS. Now here's the thing. For many women, especially those with PCOS or endometriosis, the pill is prescribed to regulate hormones, control ovulation, and reduce cyst formation. It is often seen as the less harmful option compared to surgery. But prolonged hormonal suppression isn't without consequences. Estrogen helps keep blood vessels healthy, but in pill form, especially over many years, it can also increase the risk of blood clots, raise the chances of stroke and heart attack, particularly if you have underlying risk factors like obesity, insulin resistance, or a family history of heart disease and stroke. They can affect bone density over time, which is a concern for long-term health. A recent Danish study in the BMJ found that estrogen-containing contraceptives, pills, patches, and vaginal rings can double the risk of heart attacks and stroke. Now, it's important to be clear. With modern screening and proper monitoring, these are rare complications, but the risk is much higher if you're already in a vulnerable group. Smokers, people who are very sedentary, obese, or with metabolic issues like PCOS. So what's the takeaway? The pill isn't bad for everyone, and for some it can be life-changing, but it's not something to take for years and years without review. Your doctor should screen for cardiovascular risk, check your bone health, and adapt your plan as your body changes. In short, the safest approach is a personalized, regularly reviewed treatment plan, not a one-size-fits-all prescription. Share this with someone who's been on the pill for years. They may need a check-in.